Good afternoon, everyone. Welcome once again to My Clinic for JustLogin, Make Managing Employee Healthcare Easier Than Ever webinar. Thank you for taking time out to join us this afternoon. My name is Awati Fazil, and I will be your host today. We are excited to have you with us as we share more details about our newest integration partner, MyClinic. To all the audience, you will have the opportunity to submit your question to our speakers by typing your questions into the Q&A box. You may also ask questions at any time during the webinar. We will address and answer the question during the Q&A session. It is my pleasure to introduce our two speakers for today's webinar. Introducing our first speaker, Mr. Anwar Rafiq, the co-founder and chief executive officer of MyClinic, and our second speaker, Mr. Jeremy Lee, our HR manager of JustLogin. A warm welcome to both of you. We are so glad to have you here today to share your insights and give us a preview of MyClinic, the newest integration of JustLogin. In the healthcare industry, improving employee health and reducing absenteeism is a key challenge. MyClinic Digital Healthcare Ecosystem is a digital platform that can help you manage the healthcare needs of your employees in the most efficient and cost-effective manner. Good news to our customers, MyClinic is now fully integrated with JustLogin and allow you to manage your employees' healthcare from a simple interface that is easy to use and efficient. In today's webinar, you'll find out how MyClinic can help you achieve a healthier and more productive workforce, the key benefit to adopting MyClinic digital ecosystem, and an overview of its full capabilities. Without further ado, let us welcome our first speaker, Mr. Anwar Rafiq, to share an overview of MyClinic.
Thanks, Siti, and good afternoon, everyone. My name is Anwar. I'm a CEO and co-founder of MyClinic. It's a pleasure to have here in this webinar. So, as Siti mentioned, that it's really a great opportunity and working with JustLogin, where we able to see how health is important and priority during this, especially in this situation where there are a lot of uncertainty around where the COVID and other things are ongoing. So I would be happy to present how MyClinic can make employee care, healthcare much easier than ever. Yeah. So give me a moment. Let me share the screen. I'm just going to put the screen now. Okay. Let me know if everyone can see my screen. Okay, so I hope everyone can see my screen. So basically, just a quick brief background what we do. I'll just take 1 or 2 minutes to brief about MyClinic. So our vision and mission, we make healthcare affordable and accessible. When we talk about affordability, we talk about more holistic view, and accessibility in terms of we talk about tech-enabled healthcare. Just a brief background about company. Yeah, we are around 5 years old company, started in Singapore 2018, and we have a journey of around 5 years, which started with a doctor appointment, and all the way we talk about home health system. During this period of 4 or 5 years of time, we have also expanded in a couple of countries, especially primarily in ASEAN countries. Our expansion in ASEAN countries, and we have primarily in Malaysia, Vietnam, Cambodia, Indonesia. Even we have some talk ongoing in Central Asia. We do believe also in a sustainability framework, SDG framework. So we are working on 3 and 9 and 11, which is a good health, well-being, industry innovation, and sustainabilities. Yeah. We've also been awarded locally from Ministry of Health and the government for part of President Certificate Commendation for the COVID support. Okay. Without delay, I would go to jump to exactly the topic today. So it's very question here actually that we talk about why the healthy workforce. okay, is a productive workforce. Yeah. So I mean, the question for, specifically for the HR side, or even, we talk about employees being an asset, right, for the company. So we very important to how we well manage our assets, right? That country, for our company. So if you look at why the healthy employee that, being important, right? So definitely if the employees or the assets are healthy, it means less absenteeism, more focus or target achievement, that eventually it drive profitability or revenue, right? And as well as it comes with responsibilities. So that exactly the key advantage. And you look at that, even the healthy employees having the good work culture can be set the example, create more team bonding, managing own self as well as take care of others. So not only one point, but the multiple important points and the aspect that you see that having the healthy employees creates benefit, and that leads to a profitability of the company. Yeah. Additional, if you look at also the individual, we talk about preventive or the wellness part. So we do as well look into it, how we can do best on additional aspects. We talk about mental wellness, physical wellness, and even lifestyle management. So that exactly we talk about complete curative care to a preventive care, to holistic view of managing the employee, the healthiness as well as the wellness. Now the question here is how my clinic will help on this. Yeah. So MyCLNQ is a holistic one-stop ecosystem that enables curative care, which we talk about when if your employee is sick, need some medical attention, whether it is a GP consult or even maybe a specialist consult, right? And getting online electronic medical certificate or prescription, getting the medicine delivery to your home while working from home or even office address. We even provide health screening on site, to the corporates. We do arrange yoga classes and a wellness module that we are, doing it. Even some of the corporates that we do on their place as well. And we do arrange live classes of yoga as well. So it's very much complete engagement of, employee within the corporates and, within the organization. Now, if, sorry, I go back again. Now, how this exactly works now exactly, right? So in terms of a scenario where a person or employee is not well and require to be consult to doctor, here I'm going to show you the how it should be within JustLogin, and how we bring to MyCLNQ. So if you log in of your employee or who has access, who was of JustLogin app, then there is something called virtual doctor option. You will see under that below, as you highlighted in red color. Once you click, it will directly open MyCLNQ app. Single sign on, no need to even do it any login required for your employees. Hassle free, just one click, a fingertip, one click. And the flow would be like this. So example, a scenario, let's say I'm an employee of your company and I'm working it, and suddenly example like Andrew feeling headache or stomach ache after having lunch when I come back to work. And he's not really feeling well to even go down to the clinic, who's just maybe 300 meters away. So he need to get some immediate medical attention, right? So he got a JustLogin app, open the app right away in the desk while he's sitting and working it, click on that link, open MyClinic app, choose a doctor to consult. He chooses Dr. Robert, who are doctors who connect with him, do a video call. Dr. Robert has prescribed some medications, and Andrew choose to deliver to his workplace, and that medicine dispense done, and within 2 hours, the medication been delivered to him. And he take the within 1 hour, actually, when we have 1 hour, after that, he feels better, he continue to work. Now, if you look at the whole journey, right, well, the best part is for the Andrew, not even go down to the clinic is a convenience. Whilst working in the desk, in the office itself, everything been done at fingertip. Right. So that's the whole journey. If you see the Andrew, for in terms of getting the consult, medication, and delivery, all it's one-stop solution. So that's the flow that we see in terms of getting the basic sickness through this, the MyClinic app. That's exactly all. I let pass to maybe Jeremy, and I take ask him to share how this also been done within JustLogin internal employee who have been using MyClinic app as well. I pass to Jeremy. I'll stop sharing it. Or if you have any question, I'm open as well.
Thank you, Anwar. Thank you so much for the great sharing. And good afternoon to everyone. I'm the HR for JustLogin. I think I just want to share my experience, right? I think on 3 perspectives. First is on a company front in terms of the integration we have with MyClinic. Second is my perspective as a HR, and third is my own experience as an employee using the app itself. So JustLogin, we are a HR tech company, and this integration, end of what we want to achieve is to improve the employee experience. With what Anwar has shared previously in the slide itself, we have done the single sign-on. So what it means that for all our customers, all your users, as long as you're onboarded with our program, wherever you want to visit a doctor, launch our mobile app, within 1 click itself, you would be directed over to the MyClinic app, and you can do anything that you want to do. For example, you have to book a virtual appointment. If you want to reserve a consultation, you can book it through the app itself. So it's one stop, right? It's seamless. So as a HR, right, I mean, employee concern, what do we actually want when employee falls sick? What we want to have is for them to receive immediate medical attention and to recover as soon as possible. For many of us, you would realize that whenever an employee reports sick, it takes them about 2 to 3 hours for them to come back to us to say, oh, I have gotten 2 days MC or 3 days MC, and it's because they spend a good fair bit of time at the clinic, queuing, waiting for the doctor, etc. But now with MyClinic on board with us, what we have done is that we have shortened the process. We allow the virtual doctor application to come in where they are able to visit a doctor virtually, via their phone, in the comforts of their own home, and receive the medication within hours and recuperate at home without the need of even leaving their home itself. On the other aspect, if they feel that they want to visit a doctor, what they could do is to book a consultation, and this reduces the waiting time they have at the clinic itself. So that's 2 pros. For me as an employee, unfortunately, I was sick a few months back, and at that point of time, we were doing the beta testing for MyClinic. So what happens is that I launched the app, I booked the virtual doctor experience, and within I mean I booked it about 8 for an appointment at 9:30 because I just wanted to rest. At 9:30 the I was prompted by the nurses, you know. I went into the appointment with the doctor. I flashed my IC to verify that, you know, it's me, right? The doctor asked me for my symptoms, etc. I said I have a fever, I have a headache, you know, and subsequently he said, okay, you know, he asked me for my past medical history, etc. It functioned the same as how you would have seen a doctor in his clinic itself, right? There was no fever, etc. So he prescribed some medication to me. You know, he asked whether I want to purchase it from the pharmacy or I want it delivered to my home. I said I want it delivered to my home, and I believe within 2 to 3 hours I received the entire medicine from my home. And one thing great is that there's no cash outlay for me. You know, I mean it's built directly to the company, right? And for as a HR, I would say that this perspective for different types of company, you know, this helps to also reduce your employees' cash outlay. You know, to a certain extent, it reduces. I mean, for some of you, maybe you will have petty cash reimbursement, etc. This reduces the administration aspect. What happens is that my clinic will bill JustLogin will bill you for the consultation fees, and you internalize that within your either via a benefit structure or you take it as your own business expense instead of the employee paying and coming to the company for reimbursement, right? So this is how it is, and I think as we further progress, you know, this as we are also launching our benefits module, this is something that we already have it ready for everyone. In future, we're also looking at further integrations with our benefits module where it comes to, like, you know, if you want to do things like proration, co-sharing, or there's capping, you know, then that's where within the app itself, as a JustLogin user, you can see how you want to apportion the cost and recover the rest from the employees, right? So yeah, this is my experience for sharing. Feel free to raise any questions that you might have within a Q&A, you know, and I'm more than happy to share either myself or Anwar. Right, I noticed.
So much, Jeremy, for the sharing session.
Thanks, Jeremy.
So I'll be sharing the landing page for you to look through how this integration works. Give me a second. So this is how the integration works on JustLogin. So basically, it's very simple. It's just a one click. You don't have to log in. It's all it's auto sign in. So I've shared the link to this landing page. So for our audience, you can have a look and go through it. And if you do have any question, you can reach out to our support team by clicking the button here and contact us. So let's just go through the Q&A session. Jeremy, do you have any question that you would like to answer for the Q&A?
I think I will be a better person to request some of the questions. I saw Jana Ross asked about who are my clinic competitors.
Okay. So
let's have Anwar to answer that.
Sure. So to answer the first question, who are MyCLNQ competitors? I would say, I mean, there are, you know, I would not specify any individual name. Yes, there are competitors, but I would say indirect, not direct. The reason why I'm saying indirect or direct, because we are the only one who has a comprehensive, holistic, one-stop, you know, healthcare service. Unlike others are giving some, you know, silo or some one or two services around that. So we really believe in comprehensive, you know, the healthcare solution. Yeah, hope this answers, you know, your question.
So we still have other questions coming in through the Q&A. Mr. Anwar, can you look through and see?
Yeah. Okay. The second one, I'm not at JustLogin client. So okay. So this one I would say, if you're not a JustLogin client, then please be a JustLogin client first. Okay, and then you know, can have that, subscription and everything, maybe, definitely can discuss offline with Jeremy and the team. Yeah. Yeah. Third one is, for the minimum number of employees. Maybe this one, Jeremy, you want to take it?
Yeah, so for JustLogin solutions, it really depends on your needs, right? But the base starts from 5. Feel free to get in touch with any. I think Russell will get CT. Sorry, you'll get someone to reach out to Jenna in terms of the subscriptions that we have, right? Your minimum headcount is 5. I believe we can work out something.
Okay. So the other question is, yes, okay, in MyClinic, definitely you're able to, choose the doctors, and because we have a panel of doctors in the clinics, okay, which, so one of the things that we talk about, we really believe in a patient-centric, that's only another difference with the other indirect competitors. We believe you can choose your doctor, who you want to speak, your employee want to speak, because some maybe even prefer language. So one of the things that we do enable is speak to your doctor or consult in your language, possibly Mandarin speaking doctors, or even Malay speaking doctors or Tamil. So you're able to do that. Yeah. Hope this answer. Are you able to set a budget amount that can be paid out for the claims? Maybe this one, Jeremy, you want to take it? The claim budget amount. I think you have set also, right, internally.
Yeah. So in terms of setting a budget amount for the claims, under in terms of visiting a doctor, I think the consultation and the fees varies, depending on the nature of the consultation, and also at the same time is the illness, right? On this onset itself, what happens is that whatever that your staff incur as a result of the consultation will be billed to JustLogin, and will bill you directly in your subscription. We are working on the enhancement for this to have another form of integration with our benefits module, where there is a cap in terms of how much it will be claimed, all right, and the subsequent amount, whether is it a co-share or etc.
Yeah. Okay, the next one is the clinics, and my clinics are island-wide. The answer is yes. We do have island-wide clinics, east, west, north, east, center. Yep. Offers is onboarding process. Any fee for a minimum period? Maybe Jeremy, onboarding the corporate.
I think as of this stage, in terms of onboarding MyClinic to the platform itself, sorry to steal your thunder, Anwar, but I'm happy to share that there won't be any cost for us for any of our customers to onboard MyClinic onto the JustLogin portal. Just get in touch with us, and also you're interested in this process, and there you have it. You would have it on your mobile app for you to start your consultation.
Yeah.
All right. I think that's we have answered all the questions, and for those who show interest in this MyClinic integration, do reach out to our support team, and those who have already asked us regarding the integration, we will reach out. We'll get our team to reach out to you. And I think
just to add on, Siti, just to add on, since we have some launch promotion as well, I would just like to take opportunity to tell that. So those who are early coming corporates, to avail this, we are offering first 5 consultation free, plus subsequent consultation 20% off first 3 months. Yeah. So that's the early commerce or early corporate who want to avail this or get benefit. Yeah.
Thank you so much, Anwar. I think this would be something that is very helpful to all the participants here, right? Get onto this promotion, and first 5 consultation free, right? So that's something that we wouldn't want our employees to be sick, right? But if they were to fall sick, consultation fee is something that they must pay. But now for the first 5, it's free.
I think the promotion is the most interesting part of the webinar, and everybody been waiting for that promotions. And for those who are really interested to find out more about this promotion, do reach out to our support team. We'll get back to you on this promotion, so be fast. And thank you once again, Mr. Anwar and Jeremy,
Thank
for
you,
the
everybody.
insightful
Thank you,
sharing session.
everybody.
We
Thank you
really
for
appreciate
time.
your time, and thank you for all the questions, and hope this webinar is a fruitful session for all of us. And for our audience, don't forget to follow us on our social media, on our JustLogin Facebook and LinkedIn for the latest update on JustLogin. And for more infos, you may also log on to justlogin.com. And for our Malaysia audience, you may visit us at justlogin.com.my. And to find out more, do check out our landing page on this MyCLNQ for JustLogin integration. I've shared a link on the chat box below, and do find out more details about it. And if you have any question, once again, reach out to our support team. We'll contact you directly. And once again, thank you so much to both our speaker
you.
and signing out
Thank
for
you.
today's webinar.
Bye-bye.
I'm Awatif. Until then, stay safe and see you again in the next webinar.
Bye-bye.
Thank you.
Thank you.
Bye.
Thanks, everyone.
Bye-bye.
Bye-bye.
Thanks. Bye-bye.